Am I scared? Of course I am. So why am I scared? Given that statistics show that most individuals get mild symptoms, especially if you're young, and if you lack comorbidities such as diabetes and hypertension, most likely you will pull through well. These are just population level statistics, and as much as they help to assuage us and help in making public policy, they do not necessarily apply to each and every individual. Not every young individual who gets COVID and who doesn't have comorbidities will pull through well. Being a frontline healthcare worker, this is quite evident because I have interacted with many sick individuals. I have seen very young individuals with no prior history of any medical illnesses go through a very rough patch when they get COVID. So interacting with these quite unfortunate incidents really puts things into perspective, and it brings out the worst anxieties in a frontline healthcare worker. Because in as much as we're young, in as much as we're fit, we have seen young and fit individuals succumb to this illness. So that's why I get scared. The propensity to be overwhelmed by anxiety can take over. This video is supposed to highlight how I try to stay afloat amidst all this uncertainty and fear. So how do I stay afloat? It is not weak to admit to the fact that sometimes it gets so worrying, you might prefer not to go to work totally. But wherever you're working, that's not your personal business. You are employed, you have a contract that's binding you, and the government actually invoked the Public Health Act, I think. So you have to go to work. But even as you go to work, there's a provision that states that personal protective equipment has to be provided to healthcare workers before you see patients whom you suspect to be COVID positive. Now, most of our algorithms actually start off with the point of making sure you're safe before you actually tend to the patient. So without personal protective equipment, nothing behooves you to go see a patient and put yourself at risk. By and large, personal protective equipment have been provided at workplaces, and guidelines on how to manage suspected cases have been drafted. At a personal and professional level, it's very handy for you to keep abreast with the current studies that are coming out on COVID and the best practice management of these patients. That way, even as you're managing your patients, you feel confident that you're doing it in the best way possible, and while at it, you're also protecting yourself from getting infections. Case in point, most asthmatics are normally nebulized when they come to us with just their asthma. But with COVID, nebulization really increases the probability of you getting infected as a healthcare worker. So if there's absolutely no indication for this, we don't normally proceed with nebulization. You know what would be really funny? If you protect yourself from COVID within the hospital and then get it in the community. So even as healthcare workers, we really lean on practicing sanitization methods when you're walking around wearing the masks, and that way we also don't get infected when outside the hospital. You have to practice relaxation techniques. My personal favorite, ignoring all the alarm bells out there. Alarm bells that are not backed by studies, alarm bells that just serve the purpose of making you unsettled. Of course, keeping, as I stated earlier, keeping abreast with the most current studies really goes a long way in keeping you calm and centered. Basically, you have to stick to the facts. When outside the hospital, don't focus on healthcare matters, just focus on other things. Focus on family, focus on exercising, and this keeps your mind away from whatever anxieties you might be developing. Last and definitely not least, spirituality. So however if you want to pray to God, pray to Allah. If you want to do yoga, just do whatever keeps you grounded and whatever keeps you focused. So that's us for today.